Welcome back, pet parent. Today's episode is going to be so fun because this is going to be kind of part of the series that we have been doing this year where we are touching on things that you can't really buy. When we talk about, circadian rhythm and red light and making sure we're getting clean air, clean water, like all of the things, the frequency. We're going to be talking about frequency in another episode. But today I have Dr. Laurie McCauley with us, and we're going to talk about the fascia because this is so very often overlooked. Hopefully, we're going to get into tuning forks a little bit as well. So, welcome. Dr. McCauley, I'm so excited to have you here today, and welcome to the Pet Parenting Reset.
Thank you. I really appreciate you inviting me and being able to help pet parents increase quality of life for their pets. That's my biggest joy.
And that is the thing. I was the recording just before this one, we were talking about longevity, and I started the entire conversation with longevity is great, but health span is
Oh,
better. Because what's the point? I mean, for humans and animals alike, like, what is the point of us being around for years longer if we're miserable, if we're in pain, if we're immobile, if we're like, what's the point? I don't know.
health span is huge. Frailty is huge, right? Helping these guys get stronger and healthier so that they can live a long, healthy life.
Mhm. Yeah. And a lot of it is preventive.
Mhm.
And so one of the things that I find so often overlooked, and I've had a couple of veterinarians on, and one in particular, Dr. Marlene Siegel, where we really did a little bit more of a deep dive into like what it actually means to detox the body, because it's very easy to go online and for everybody to say, oh, well, you need a detox. Are you detoxing your dog? Are you detox? Like, but how you actually do that isn't talked about as much, and people are just like, "Okay, so what supplement do I get for that?" Like, and it's not really that simple. I mean, we can use things like glutathione and, whatever, but the fascia is so fascinating to me,
Oh,
and first of all, let me backtrack just a little bit because I would love for people to just hear about you first. So, yeah, tell me a little bit about you. Tell me a little bit about how you got into veterinary medicine and how your career in veterinary medicine has evolved to where it is today.
my gosh, I have a crazy life. I love it. Don't get me wrong. I'm very, very blessed. I got into veterinary medicine. Literally, my mom said, Lori, you're smart. I grew up on Long Island. And she said, you're smart enough to become a doctor or a lawyer. And I'm like, well, I want to be a veterinarian. And I started to volunteer when I was 15. And I'm like, this is amazing. And I got through vet school and I got to my first job. And I was like, this is really cool. And then it was like, I had one good case a week and then one good case a month. And then I'm totally bored. And I'm like, "Ugh, another dog with diarrhea or another cat with a urinary issue." And I fell down the stairs at 4 o'clock in the morning, putting my dogs out, and my hurt my back. Went to my chiropractor. He couldn't fix me. Sent me to an orthopedic guy who sent me to a physical therapist. And I'm like, oh, this is amazing. This is what I want to do. And I went to look for a certification course, and there was nothing. So I did research with if you remember Alameda East, which was Emergency Vets, a TV show a long, long time ago. I went out there. We did some research. I started the first rehabilitation program for dogs. I developed the first underwater treadmill for dogs. I taught the certification course for vets, techs, and PTs for 14 years. I have been blessed to be able to write chapters in textbooks and articles because I just love to teach. My life goal is empowering people to optimize the health of their pets. So that is what makes my heart sing. I have a house call practice here in North Carolina. I do locum work at LSU, meaning I get to pretend I get to play as head of integrative medicine at LSU, the vet school, a couple times a year. I have Optimum Pet Vitality, which is an online teaching platform for both professionals and for pet parents. So we've got courses on fascia, the tuning fork, cranial cruciate ligament disease, exercise, laser. Totally believe that more and more people are going to be doing laser therapy at home as well. And I just love what I do. I work 7 days a week, and I'm one of those crazy people. I don't get on social media except to check on things. Um, tiny. Uh, I I don't watch TV or do movies. I read research for fun, and I work on dogs. And I am very blessed to be able to help other people help their dogs. But actually, last 2, 3 weeks ago, I was in California with a vet friend of mine working on some very expensive horses. Just helping her learn what I do on dogs so she could do it for the horses.
That's amazing. I get it though. When you love what you do, it really isn't work, so you just do it all the time because you love it.
Mhm. I tell people I get to go to work. I don't have to go to
Yes,
work.
and that's such a huge difference. Oh my goodness. It makes such a huge difference in how you show up to the world. It makes such a huge difference in, like, your quality of life. Like, I'm so thrilled that you love what you do.
Well, and I tell people I have the best job in the world. When I see patients, I get to sit on the floor and play with dogs and make them feel better. So they want to be with me, right?
Mhm.
What could be better?
I know, right? That's so amazing. And you have such a like, that's amazing, all the things that you have done and kind of blazed a trail for so many other people to follow and to what ultimately leads to, physical therapy for our animals because it's life-changing when especially, if there is a disease or an injury that we need to recover from, like, we need to be able to support the body in that process. So what, I would love to just start to dive in a little bit to the fascia and what that actually is. Um, sorry. I should turn off my notifications when I'm recording. What is it? Why is it so important? How can pet parents start to think about their pet's health differently when we actually pay attention to, like, the actual physiology of what's going on here?
Well, let's start with what is fascia.
Yeah.
So, fascia is the stuff that is between all the cells. So, it literally wraps around the cells. Think about like a 3D spider web. So, and not only does it go around every single cell in the body, there's electron microscopy that shows that it goes into the nucleus of each cell and touches the nucleus. So and it's all one. It's not like there's a little here and there's a little there. It's all connected. So it's around every muscle fiber, every muscle, every tendon, every ligament, every organ in your body. It is around the brain. So we think about like the meninges, around the brain, the dura mater around the spinal cord, the pleura around the lungs. It's around everything. It's around every lymph vessel, every blood vessel, every nerve. And when it's healthy, it takes the fluid. So you talked about physiology. Every cell needs nutrition and then it expels toxins and metabolic waste. And that has to go through the fascia to go to the lymph nodes. And then from there it goes to the lymph ducts. And then it dumps out on the left and right side at the subclavian into the subclavian vein. So we have our left side is our thoracic duct, our right side is our terminal duct. That's when fascia is healthy. Things like inflammation, inactivity, age, all of that increases stiffness. Um, we see fat and metabolic waste. Think about that spider's web now being sitting in jello. It's what I call sticky icky. And now it's contracting around the muscles, around the blood vessels, around the lymph, around the nerves. So now you have less nerve transmission, you have less blood flow, you have less ability of your immune system to work because your lymph isn't getting rid of all the metabolic waste and toxins. There's a study done in rodents where they injected cancer cells into all of the rats, and then half of them they left alone, and half of them they taught the rats, because rats are pretty smart, how to stretch, and they did the fascial lines, and there was significantly less metastasis in the rats that were just stretching their fascia. So even by stretching it, we can strengthen it. There's a study looking at a competitive javelin thrower, right? So you would imagine a competitive athlete is going to be doing like push-ups and all of the things to strengthen his upper body so he can throw the javelin. And they measured the fascia around his bicep tendon, and on his non-throwing arm, it was 0.5 millimeter thick. And on his throwing arm, so this is again, he's working out, right? It was 3 millimeters thick. So it's 6 times thicker. So think about all of the dogs that have like cruciate injuries. If we can strengthen the fascia around their knees, we can decrease the chance of tearing that cruciate ligament. So there's so much that we can do, and we can get rid of the fascial restrictions so that their immune system's healthier, there's less pain, there's less stiffness, they move better, they feel better. There's just so much we can do.
The first thing I was like, the only thing that came to mind when you were first describing what the fascia is like the mycelium network that is like so vast underneath the ground, and how like the
Yeah.
trees are all like trees all over the whole world are connected somehow. And like that's kind of where like my brain was like trying to make sense of it, and that's where I went with it. But it is so fascinating that it's it's so vital, and yet we are not talking about it.
So let me give you an example so people have a visual. So if you've
Okay.
ever made a Thanksgiving turkey and you took your butter and your herbs and you put it
Mhm.
between the skin and on top of the breast, you're pushing through that soft fascia. So that yellowy stuff that's connecting things, that's fascia. If you've ever had a steak and you see that it has a shiny layer to it, or you cut through and you're like, oh, that's grizzle, that's dense fascia. That's what holds the structure and holds it all together. So people have an idea, a visual of what does it look like? What is it doing?
Okay. So, it's obviously crucial, and you describe not just in mobility, but in, bringing nutrients into cells, releasing toxins, from the cells, getting them through to the lymphatic system. That's that's the piece that is often missing in so many protocols, and like
Mhm.
especially, I mean, the reality of today is that everybody wants a quick fix, and there are no real quick fixes. Like that just isn't reality. But aside from that, even a lot of the protocols that we do see that can be effective, that's still a piece that is missing. And um it's something that I really want people to start thinking about, because I think we have to think about our pets differently than the way we're thinking about them right now. It's not just it's kind of like diet culture, like calorie in, calorie out, and that's kind of how we're looking at, even in the holistic space, how we're caring for our pets. Well, I'm gonna give a better quality or a holistic supplement instead of this pharmaceutical, or and yeah, that's helpful, that's beneficial, but we're still not looking at the whole picture.
It's a lot, right? There's a lot for people to know. I mean, I'm still learning and I've been learning like crazy for as long as I can. And I do want to tell you that when you're dealing with fascia, a lot of time there can be a quick fix, not necessarily the whole thing, right? There's no silver bullet in medicine. That's why they say we practice it. We don't know it. But I've literally had pets where they have restricted carpal flexion and moving the fascia and breaking up the scar tissue around the joint. And literally within minutes, we've got like 20 degrees more flexion.
Mhm.
Or the hip, taking it into extension and releasing a fascial line. And all of a sudden, you've got 10 to 20 degrees more extension. And where it was painful, now there's no pain.
Mhm.
So there's for motion, for getting rid of the issues. Can I tell you the story of how I got into the tuning fork? Talking about
Yes.
and quick fixes.
Yes.
So I was hiking with my dog Sid, who's back here. He's always with me. And I live in the mountains in North Carolina, and I was up on top of a mountain. Thank God I had my neighbor with me, and I fell in a stream and I broke my fibula. And I'm board certified in sports medicine and rehab, right? One of 130 in the whole world. So I did everything I could to help it heal as fast as possible. And the swelling was huge. And I'm certified in acupuncture, chiropractic. We're doing osteopathy. We did physical therapy, ozone, CO2 therapy, anything you could think of, I was doing. God, how cute. And, my physical therapist is like, "Laurie, chill out," right? Because he knew I'm kind of a nerd. He's like, "It's gonna take a year to a year and a half for that swelling to go away." And I went to an osteopathy course in Oregon, and, Patrice teaches like 12 to 15 veterinarians a couple times a year. She comes over from Finland, and she, says, "Laurie, I will fix you." So this is 3 months in. right? I am frustrated because of the swelling. She says, I'll fix you. And in 72 hours, 80% of the swelling will be gone. And in 2 weeks, the rest of it will be gone. And she did. She cleared my lymphatics with the tuning fork. And before I left, 80% of the swelling was gone. And within 2 weeks, the rest of it was gone. And my PT was like, what did you do? So, of course, I told him. I don't know if he's using it, but it's just amazing.
That that is really amazing. What what are some like, are there things that pet parents can do at home
Oh,
with their pets?
absolutely.
Yeah,
Absolutely. So Sid is my demo dog.
yeah,
So if you and you've got your dogs right there.
yeah.
So there's simple things you can do, like if you've got an older dog,
Mhm,
if you take their, let's see, where's your head? His head's here, right? His back's
mhm,
here. This is his body wall. If you
mhm,
take your fingers and attach your fingers to his skin and see if you
mhm,
can move it around.
mhm,
Up by the neck, it's going to have the most motion. And then as you come
uh-huh,
lower on their back or on their side, if you don't have a lot of motion, they may have fascial restrictions right there. And
mhm.
just you doing that and going in all different directions can break up the fascia,
Oh,
those
interesting.
restrictions,
Yeah.
right? We do skin rolling where you're literally, come here, boo boo, coming and can you see how I've got, right?
Uh-huh,
And doing that in all different directions, and that will break it up. You can use the tuning fork, right? So I've got my tuning fork with an amethyst tip because amethyst is best for soft tissue. You can come down and feel. So, like, I don't know if you saw that he just had a spasm right there.
uh-huh.
Fortunately, I don't know if you can see his boo boo. He got attacked by a dog week and a half ago.
Oh, no.
So he's got things going on. But can you see how that grabs right there?
Yeah.
That means he has a fascial restriction, and
Ah,
literally within a couple minutes, that will be gone. Trigger points are gone within usually 30 to 40 seconds. So there's things you can do with your hands. There's things you can do with the tuning forks. There's laser. Um, there's lots that people can
mhm.
do.
I think I've definitely seen where, like, in this I see it very often on cats. They have this, like, where you touch them and their skin crawls.
Uh-huh.
Um, and I've seen it some on dogs, but it's very, very common in cats. Is that something similar to, like, a fascia restriction?
It may be. So
Maybe?
cats usually have a lot more motion. My
Mhm.
cats are like Gumby, right? They can do all
Yeah.
kinds. They almost turn their head like an owl the other way. Um, but if you have something, you can always, like I said, eat. The simplest thing is just put your hand on and move around, and
Mhm.
see if you have any restrictions. Um, but, the dogs, if you have that spasms, right, which is what we saw with Sid, that's a neurological twitch that is associated with pain, right? So it's not
Mm.
something we don't want to be there.
Yeah. Well, even, like, when I was just kind of touching my brother's dog behind me, when I got to his back right hip, he kinda turned, like,
Yeah.
and I was like, "Oh, okay. Maybe I don't want you to bite" like, he didn't act like he was gonna bite me, but, that's kind of a
He's
warning.
communicating. He was
Yeah,
saying, "Hey, what are you doing? I'm paying attention. Please don't do that." Right?
yeah, yeah, yeah. Those are all signs as well, and I mean, not to get deep into, like, animal behavior or anything, but, we do kind of not pay attention to the signs our animals give us very, very often, which can get us in trouble. Often gets them in more trouble because they have warned us, I don't know how many times, and then we keep pushing and pushing and pushing, and then we wind up getting bit. But, yeah, so doing um just putting your hands on them, moving around their skin, that is so interesting, and I do that with my dog. Well, I have done it with her for so long. It's just like our nighttime routine.
Mhm.
Well, it has been. We get on the couch. If I'm able to watch something on TV, I'm usually working, but I'll, have something on, and I touch almost every part of her body.
Yes.
She still doesn't love me touching, like, her paws or right around her mouth, but, I didn't adopt her when she was a puppy. She was older when I adopted her, so we worked towards it. But I mean, I think that's probably one of the best. Huh?
Can I help you with that?
Yeah.
Have you ever had a hand massage or a foot massage where they come in and they rub
Mhm.
your palms?
Yeah.
Do that on the dogs. So
Okay.
you know how, like, with a little kid, they're like, "Ah," and they wanna
Uh-huh.
hold your hand? If you
Uh-huh.
can, I don't know if you can see, there you go, Sid's foot,
Uh-huh.
and you can see here's his pads, and then
Uh-huh.
here, if you
Yeah.
here and rub that and then hold his paw so he knows you're not gonna cut and tell him, "I'm not gonna
Uh-huh.
cut your nails, you're safe."
Oh, yeah.
Love that. Front feet, back
Aw.
from every front foot. Thank you, baby.
Yeah.
Right? I can come in here and that will help him learn to trust you. But you
Mhm.
can't lie to him, right? Tell him
Yeah.
and cut your nails. And then if you are gonna cut his nails, go, I promise you I will try my very best not to hurt you, but we are gonna trim your nails.
Yeah. Yeah.
Right? Never lie to them because then they won't trust you. But yeah, if you come in here, that feels so good to them. They totally relax and melt as though you were getting your hands or your feet rubbed.
Yeah.
And then for the mouth, when you go in, start with massaging. Okay, come here, buddy. I know you're such a good boy. If you know about T-touch, 1 1/4 circles,
Uh-huh.
that's turns on the nervous system for relaxing. And then once you get used to they get used to you doing the outside, then you just come in and do their gums.
Interesting.
You do
He
that
is
before you
he is
start brushing their teeth. You'll be like, oh, that's not so bad.
he is just letting you do anything to him.
He's the best.
I love that. I love that. Yeah, need to work with my girl a whole lot more with that. Okay, fascia. It's
Yes.
important. There are things we can do as pet parents to work on this every single day with our pets. And do you I mean, are there instances where you would say, "Hold up, maybe let's not do this every" like, are there if there's an injury,
Right.
how do you
Well,
work
you
around
only massage over a surgical
Mhm,
area. The rule of thumb is at 2 to 2.5 weeks. If say this was the incision, you can
mhm,
go parallel to the incision, but not over it. And you want to wait till at least 3.5 to 4 weeks before you go perpendicular to it because you don't want to open it up
right,
because it's a surgical incision. You want it to heal. Massaging on both sides or massaging big around it increases blood flow so it heals faster.
mhm,
So massage is a great thing. And I love, Jess, that you put your hands on your dog every single night, right? So that you will find trigger points, growing tumors, ticks, all of those things. Whereas if the dog is just outside and inside and running around, you would never find it until it may be too late.
yeah. Well, it has been something that I have done with her for so many years, and I couldn't imagine not doing it, honestly, because it's not just yes, I'm gathering information, I'm making sure she's okay, I'm making sure that she doesn't she's so over me recording today, already. So this is why she's, like, whiny and in my lap. It's also past her dinner time, so she's like, "No, you should have fed me way before now." But she's okay. She can wait a little bit. Um, but it's also bonding.
Oh, yeah,
Uh,
it's huge. It's
yeah.
being present, right? The dogs
Mhm,
help us be present. It helps our stress level. It helps our whole physical being. People who have pets live significantly longer than people who don't.
mhm. It's amazing. So tell me a little bit more about these tuning forks. That is just fascinating to me because it it seems so simple, but it sounds almost like a miracle.
Okay, so I love it. And nothing is a miracle in medicine, right? So, I mean, I always tell people when they're like, I don't know where's the research on that? 150 years ago, a gentleman said, hey, look, the doctors who come up from necropsy and then deliver a baby, the babies and the mothers are much more likely to die than if they come from home. Maybe we should wash our hands before we deliver babies. And he got ostracized. He got his license taken away. He died a pauper, right? Because we didn't understand what bacteria was. Now we understand, and it would be malpractice for a doctor to go into surgery without washing his hands. So we have the tuning forks, we have frequency. There's so much in quantum physics. I love quantum physics that talk to us about, what we see matter is 0.001% of what is, but it's what we can see and feel and touch. So we know it's there, but we don't understand yet all of how it works. So with the tuning forks, when I was a kid 50 years ago, if you fell and you're like, oh, I don't know if my hand is broken or my foot's broken, and they took an x-ray and they couldn't tell, they would activate a tuning fork and put it on. And if you're like, oh yeah, I feel the vibration, there's nothing broken. If you're like, oh my God, that really hurts, they're like, oh, something's broken. because there's no nerve endings in bone, but there's nerve endings in the periosteum, the fascia around the bone. And then the pieces would vibrate separately and it would cause a lot of pain, right?
Mm.
We use tuning forks now for hearing. There's different tests that you can do or for neurological disease to see if you can feel the vibration. But after I worked with Patrice, I went and did a ton of research and studying and figuring out what we can do. And I use a tuning fork that's 128 hertz. And I will tell you, there's really cheap ones out on the market that are horrible. They're not the right metal, they're not the right frequency, they don't work. We do have the Tuning Into Your Dog course, which sends you, if you're in the United States, a free tuning fork. So I never wanted anybody to say, I learned something from Dr. Laurie and it didn't work because I got some piece of equipment that didn't work. And it comes with the amethyst tip because that's the best one for soft tissue. So literally, you can activate it, you can put it on a trigger point, and in 20 to 40 seconds, the trigger point is gone, just gone. You can activate it and listen to it. So you're young, but at some point you're going to hit menopause and you're going to be like, hey, it's 4 o'clock in the morning. I really should be sleeping. I don't have to get up to 6. Oh, wow, I'm going to be tired this afternoon. And you can't go back to sleep because the default mode network, the part of your brain that is the chatter, is activated. And the 128 hertz shuts that down. So it
Mm.
turns on the parasympathetic nervous system, your rest and digest part. You put 30 to 45 seconds in each ear and you can go right back to sleep. You can literally, you've got a point up here, which is an acupuncture point. It's also a chakra. Same thing right here. That is where the fascia around the brain attaches to the skull. So thousands of years ago, they said if we stick a needle here and here, we're going to release beta endorphins and decrease pain and decrease stress. Um, a couple hundred years ago or 100 years ago, they said, oh, look, we released the beta endorphins. It's attached to the skull. Those are important points. We also know the sutures come here and here. So the bones of the skull don't fuse. They have sutures. And as your brain pumps cerebral spinal fluid down, the bones move slightly. And if they get jammed, they don't move as well. And CSF doesn't flow as well. It's not going to create a lameness in a dog, but it's going to change their nervous system a little bit. And you can literally put it on different points on the head to make sure the sutures are vibrating it back into place so that the nervous system can work better.
That is so like, my mind is just going everywhere, with that. That's so.
Can I throw one more at you?
Yes, please.
So it's a diagnostic tool as well as a therapeutic tool. So if your fascia is healthy, it slides and glides. And let's see, left side. Yeah. Can you see how it grabs like it did with Sid?
Yeah.
That's because that's where my thoracic duct is. So all of the toxins and metabolic waste come into the interstitial fluid, into the lymph nodes, through the ducts, and then it empties here and here on humans. Same place in dogs. 75% is on the left side, 25% is on the right side. And then it goes into the subclavian vein, goes to the liver, and that's what gets rid of the liver, detoxes you, right? We were talking about detoxing. So literally you can, in a couple minutes, clear this. And I just flew in a couple days ago. When you fly, your immune system gets kicked a little bit and you get more sludge in your lymphatics. Clear it. And that's how we cleared that. And then all my lymph nodes. And that's how I got rid of the fluid in my ankle. And it's the same thing, right? It's the same thing with the metastasis, right? You help your immune system work. So you have less ability, you have less problems with infection because your immune system's working better. You have more blood flow to your organs. It's just super cool.
So you mentioned that you have, a course. I know you have multiple courses. Is there I have one book around I don't even know where it is, on, like, acupressure
Yeah.
points,
Yeah. Yeah. Yeah.
on my dog. Are they similar to, like, where you're talking about with the tuning fork and all of that?
So you want a good laugh?
Yes.
I have literally done heart surgery on a 12-week-old puppy. I've
Oh.
taken basketball-sized tumor out of a mastiff, and I am needle phobic.
Mm.
So for humans, so I can't watch when my acupuncturist put needles in me. I'm certified in acupuncture. I can do it to myself if I absolutely have to, and I have to deep breathe. So when I go to my acupuncturist, she will put needles in me, and then because she knows I have the tuning fork, you can stimulate acupuncture points with it. She'll take a Sharpie and put dots on me on where I'm supposed to stimulate later on.
I love that. I mean, That's so cute. Like, here's the I'm just gonna
Check it
make a
out.
map. I'm gonna put a map on your body. I love it. I like well, and, I of course, acupuncture, you need to go to a veterinarian who is trained in acupuncture for your animals for that, but I think, acupressure is something that
Oh,
people
yeah.
can learn at home, so I'm thinking, like, those points, if you're learning those points, that could be beneficial. Oh, bite. My dog is just she's on another level right now, I'm so sorry.
No, that's fine. Actually, in the course that we were just talking about,
Yes.
tuning into your dog, I think I have,
Yeah.
like, the top 10 acupuncture points for people so that they
Oh,
know where
nice.
they are. I show them, and they can use the tuning fork on it, so they can do it at home.
Awesome. So what are some of these cases? Before we started recording, I was asking a little bit about lipomas, so we can start there. A- as we were talking about, they're not emergent, like, lipomas are not emergencies. If, like you said earlier, if you aspirate them, there's not mast cell inside, that we are just dealing with fatty tissue. These are not emergencies unless they are restricting mobility or they're in a really weird spot. Like I was telling you with my cat on her throat, I was concerned because it was growing and I didn't want it to restrict, um, either airflow or, her ability to swallow, anything like that.
So wait, so before you go further from there, just
Yeah.
because, you have cats and you had a cat with a growth,
Mhm.
rule of thumb in dogs is if you have a growth, it's a 50-50 chance whether it's a problem or not.
Mhm.
If you have a cat, it's usually 90% chance that it's a problem. So if you've got people that have cats and they have growths and they have dogs before, it's not the same. Your
Okay.
cats you absolutely want to have checked out as soon as possible.
Yeah, that's good to know. I mean, I had that one aspirated and I knew it was just, fatty cells, but it would, like I said, it was growing and I was
Yeah.
concerned
Oh,
about
yeah.
it just because of where it is, but, people do get scared, about these growths, and I've even talked to people whose veterinarians have scared them about these growths, even when they are not in spots that are, hindering mobility or anything like that. So, it just fascinates me, some of the things that we can do, because they're not easy to get rid of. They're just not.
No, no.
Um, but what are some other things that you have worked with? Other
Yeah.
instances, other situations?
So lapis. So
Mhm.
I'm a huge the universe, God, whatever you want to say, works through me. Oh my God, you got lapis! Yay! I
Yeah,
love it.
and it's a
Very
doggy.
cool. I'm a huge. I love, love, love lapis. So Sid, my heart dog, I lecture a lot, so I'm in and out of town. He needed emergency abdominal surgery. We thought he had a foreign body. Thank God he didn't, but he still had emergency surgery. He comes home. I'm in and out of town. I come home and he has an abscess. His sutures
Mm,
abscessed and he has a ton of scar tissue. And just like with my ankle, with the swelling, I'm like, what do I do? And I tried my laser. It helped a little bit. I tried my PEMF device, PEMF, pulse electromagnetic field therapy. It helped a little bit. I tried my amethyst tuning fork, wherever I put that one down. It helped a little bit. And I'm like, what do I do? What do I do? And I'm like, wait, lapis, lapis. Lapis is for scar tissue. Let me try that. Within 8 minutes, the scar tissue was totally gone, totally flat. So again, I lecture, I work with people when I'm at conferences, and I have seen like thick scar tissue where someone's had like, a motorcycle accident. Now they've got in minutes, literally minutes, it's gone. I had a Stanford nurse at one of the conferences who was a pianist, and then she had to have something removed here, and she didn't have full range of motion. And she did it. I didn't even touch her. She activated the tuning fork and used the lapis. And in about 2 minutes, she's like, oh my God, I have full range. I've had a chiropractor because I was lecturing at the American Veterinary Chiropractic Association who had a salivary gland removed. Not even scar tissue on the outside, but the scar tissue was on the inside. And we use this. So she is 40 years old. This was just a couple months ago. And she had it taken out when she was 17. And again, we do this and it's sticky icky. And all of a sudden then it's sliding. And she's like, oh my God. And I'm like, what? She's like, I can move my tongue fully. I haven't been able to move my tongue fully since I was 17.
Oh, wow.
I had another chiropractor, same meeting, comes to me and I always say, how can I help you? right? And she said, I've had ulcerative colitis for the last 12 weeks. And I'm like, I am a rehab vet. I haven't done general medicine in a very long time. And I'm like, okay, what can I do? What can I do? I'm like, citrine. And I grab my citrine stone and I go to her abdomen and it's totally sticky icky. Like this is probably took the longest. It probably took 20 minutes to get it so it was all clear. And I'm like, I don't know if it's going to help. And the next day she came and she's like, Lori, I had to come back and tell you I did the skinny dance last night. And I'm like, okay.
What's that?
No. I had pizza for dinner. I'm like, okay. She's like, you don't understand. For the first time in 12 weeks, I had a meal and I didn't look like I was 9 months pregnant. All of the inflammation in my GI tract was gone.
Wow.
Right? It's crazy. I had, the last conference I was at was, in Ohio, and there was a tough cowboy kinda guy, right? Like, horse vet, had really arthritic knees, and he's like, "Can you help me with this?" And I'm like, "Okay, let's work on your fascial tracts. Let's work on the fascial restrictions around your knees." And I swear to God, this man got up and started crying because he could move his knees more than he had in over a decade.
Wow. Wow.
So I think of like all the people that have dogs. I don't know if you know this. I actually have multiple lectures that I give all around the world on cruciate disease. Orthopedic surgeons now, 50 to 80% of what they do is just fixing cruciate disease. So trying
Wow.
to prevent it from happening, right? Obviously, once it happens and you have the surgery, because surgery is still the best option once it tears, there's a lot of things we can do to decrease the arthritis, but you're always going to have arthritis, and then how to prevent it. But yeah, all these people that if their dog has a cruciate issue, getting rid of the inflammation and improving range of motion so they don't have the secondary hip problems or back problems or forelimb problems, shoulder problems from pulling their weight forward, all of that.
That actually is where my mind has been going as you're talking about all of these cases because my first thought is, okay, it was relieved. How long is it gonna be relieved for? And honestly, for a lot of these issues, it's probably gonna be like, these people would walk away and say, "If I have to do this every day, I'm good. Let me just do this every day, that's fine." But, like, are there 1, is that the case? And 2, do we also need to address, like, what I mean, we
Oh,
also
the
need to
root
address the
problem.
goddess. Yeah, yeah.
Absolutely. So like I've cleared myself 100 times.
Right.
They just flew,
Mhm,
right?
right.
So if you fix something, but then you continue the behavior that caused the problem, it's going to come back, right? If it's an acute injury and you heal it, it should be gone for good as long as you don't have complications. So, to give you an example, I've been certified in chiropractic since 2000. I probably haven't put a hard thrust into an animal in over a decade, right? Because I'm usually working with the soft tissue. And now I use osteopathy techniques and I literally do visceral manipulation so that I have two or three things to fix in the spine because I'm fixing the root problem rather than the compensation. So I
Mm.
always try to go to, the root of the problem so that it doesn't come back right away. And I can see my clients every 12 weeks, right? Or 16 weeks rather than every week.
Yeah, I remember I haven't seen them lately, but there was a time when it was like every other video I would see on social media was somebody, don't know who they were, doing chiropractic on a dog, and it was these, like, really harsh, like, oh my gosh, to the point where, like, the dog would turn like they were gonna bite, but then realize that they felt really good and then
Yeah.
they didn't
Oh, yeah.
bite, and I'm like, I don't is that okay? Like,
So
should this be
what how
happening?
I look at it is if God gave us one way to heal, we'd never find it, we'd all be dead. So he's given us thousands. And every healer has to find what works best in their hands. Like I said, I have not put a hard thrust in, but I was lecturing up in Alaska and I watched Jeannie Olson do traction on an Iditarod dog, a very highly competitive dog, and do one of those, just a twist. And it went pop, 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 pop. And I went, and the dog went, "Oh my God, thank you. That feels so much better." I could never do that. That would not work in my hands, but in her hands, it was magic. So it truly depends upon who's doing it. And there's good people in there's good cops and bad cops. There's good firemen, there's bad firemen. There's good doctors, there's bad doctors, right? You want to find somebody that you feel comfortable with that you feel does a good job?
So you have courses, and the reason I'm bringing this up again is because the next place my mind goes is okay, yes, maybe I have a dog that has issues and I want to experiment and use a tuning fork or even just literally start with moving my fingers around on their
Yeah.
skin and doing all the things. Or maybe I don't. Maybe my dog is perfectly fine, perfectly healthy, and I just want to stay on top of this and make sure they stay that way. Obviously, there are things we can be doing at home, but I would imagine that what you're teaching people is going to empower them to be able to feel confident in it and maybe do a better job at it.
Competence leads to confidence. And my whole mission statement, my life is empowering people, optimizing pet health, right? So I even tell my clients, I'm like, the more I can teach you, I love you. The more I can teach you, the less I need to see you. Not because I don't want to see you, but so that I can help somebody else because there's only so many hours in a day. So, yeah. So if you're someone who wants to like put your hands on your dog and learn different manual techniques and other things like that, Fascinating Fascia is the right course for you. If you're like, that's really cool, but I want to use the tuning fork because that sounds really, really cool. And I've got swelling or I want to increase the immune system. I want to learn all about that stuff. Then tuning into your dog where you get the tuning fork again, as long as you're in the United States, would be where you would start. If you're like, you know what, I have a young, healthy dog and I just want to strengthen them and I want to play with them, we have Core and More, which when I got Sid, he was 11 months old. I got him from the Humane Society. He was my dog. And I looked at him and said, dude, you have straight knees, straight shoulders, and a long back. I am a rehab vet. You are not going to have a cruciate injury. You're not going to have a shoulder injury. You are not going to have an iliopsoas or a back issue. And I designed a exercise program for him. And then I sent it out to some of my friends. And one of them, Laura from Chicago, had a 9-year-old competitive agility dog. At 11, she was the 7th fastest Sheltie in bad dog agility. So everyone else was like 4, 5, 6. And here's this 11-year-old in the top 10. She's like, Laurie, I had no idea what my dog's potential was. But by strengthening the core, and I don't mean just the trunk, I mean the limbs, the joints, everything, you decrease injury, you increase longevity, you increase health span. So if somebody's like, that sounds like what I want, it's 24 exercises, I want to do that, Core and More would be where you would start. So there's lots of options.
Yeah, I think not I'm not particularly a religious person, but it was popped in my head like your body is your temple,
Yes.
right? And the same is true for them. They only get one body,
Mhm.
and it is our responsibility as their guardians to help them maintain it, especially when we have really forced them into an environment that is so incredibly unnatural for them.
Mhm.
With the stairs and the hardwood floors and all the things. Like, I don't know if you cover any of these things in your courses, but just managing the environment for them in a better way can be so helpful.
And understanding what overheating looks like and understanding what fatigue looks like. Yeah, we cover that. So we want them to have the best life possible.
That's amazing. I'm sure we could just talk and talk and talk for I mean, obviously, you said your passion is to teach people. I'm just, like, kind of reeling over what we can do at home with our pets for free. Like, it doesn't like, yes, please go check out Dr. Lori's courses, but you can start, like, right now, today, go home, or if you are home, and just
Can
put your hands on your dog.
Oh, yeah, absolutely. Can I give you an exercise that anyone who's watching
Yes.
can
I
learn?
would love that. Yes.
So, rhythmic stabilization literally turns on all the core muscles. It's super simple. And when I work at the clinic with people, I tell them, like, this, you're going to look at it and you're going to be like, that's nothing. And then I do it to them and they're like, oh, okay. So with Sid, come here, boo boo. Come here. Oh, back so people can see you. Can you step back? Back. All right.
He's like
So standing, and you can see at least some of him.
yeah.
If he's standing square, now realize he's on top of the couch. So he's on a soft surface, which is going to make it even harder. Come on up. Put your feet down. There you go. If I push him, stay. Good boy. Stay. Stay. Nope. Stay up. Good job. Stay. Yes. Good boy. Stay. Good boy. Stay. Yep. Nope. Stay up. Good job. Ready? Stay. Yes. And I pull. Stay. Good boy. I'm turning on his muscles. So I push him and he's pushing against me.
Mhm.
It's an isometric, meaning it's safe for a 16-week-old puppy and a 16-year-old dog. And yet it's turning on all the muscles that are surrounding his spine, his hips, his knees, his hocks. And it's a great exercise. If you were to do it to a person, you would tell them to stay and then you would push them in different directions. And it's not like a shove, it's
Yeah.
a slow, steady push that they're going to push against. And that's what's turning on the muscles.
Wow. That is I'm thinking about it. I'm just thinking about, like, if somebody were doing that to me, how that would feel. And, yeah, it would be very like, if you're not strong, if you haven't worked your muscles at all, like, it would be very destabilizing.
So think about it the other way.
Uh-huh.
So I usually, when I'm at teaching to a whole group of people, I'll pull somebody who doesn't look strong and I'll push them and tell them to stay. And at first they don't have those muscles turned on. And then
Mhm.
I'll go in a different direction and a different direction. And by the second or third time I'm pushing, muscles are turned on and they're stabilized. So
That's
you're
amazing.
literally turning them on. And so you want to do something like that in the first thing in the day, right? You don't want to do it, hey, let's push you and then go to sleep. Right?
Right.
Get up in the morning, turn the muscles on. Now let's have our day where you're using your muscles better all day long.
I love that. And that's so true. Yes, you don't wanna turn anything on right before you go to bed. Turn it all off. That's when I take my massive doses of CBD so that I can sleep. Oh my goodness, yes. Okay, well, I think I just wanna encourage people to check out your courses because I think this is so powerful and so impactful, and it's health it, like, we're we're just encouraging the body to be in its best shape possible.
Oh,
Like,
yeah.
I don't see a downside in it. It's not like risk reward. What there it's
Right.
reward.
Yep.
It's all reward.
Can I add one to that?
Mhm. Mhm.
I will send you a link so that if people want to know where trigger points are in the dog, we have a PDF of the top 5 trigger points.
Okay, perfect.
So I'll send you the link if you want to put it with the podcast.
Yes.
And this way people can get an idea of where to look for the trigger points for their dogs so they know how to help them.
Yes, absolutely. I will put that in the show notes, on all of the platforms. And my ca my dog as my dogs are barking, going crazy, the cat came up to say,
Aww.
"Oh, it's my
Hi,
baby boy."
sweetheart.
He is, he is the only cat I have left, which is so strange for me. I will say at the peak, I had 12 cats, and, now I only have he's my only cat left. He's 17. He is blind because he had a perennial urethrostomy surgery,
Mhm.
and, I didn't know any like, it was a traveling, surgeon. She was doing the surgery by herself in my vet's clinic, but she was by herself, and he was not being monitored. He stopped breathing.
Oh,
He
no.
suffered brain damage. He had swelling on the brain. He had seizures.
Oh.
It took me once we got him stable. So they sent him home with me that night. Should not have happened. I was at the emergency that first thing in the morning. Once we got him stabilized, it took me 30 days to get him to learn to walk again.
Oh, no.
But the only thing that like, he because of the swelling on the brain, he like, his eyes are incredibly healthy, but he can't see. So, that's the only
See, now I go to, if I had known you when that happened, so you've got your carotid artery comes up and gives blood to your brain, and then your jugular vein comes out through the jugular foramen, so all the lymphatics and the veins come out through there, and you can free that up by using the tuning fork on that fascia to
Mhm.
allow everything to drain better. So if you've ever had a headache or brain fog and you've rubbed the back of your neck and you're like, "Oh, now I
Mhm.
feel a little bit better,"
Yeah.
it's because you're working on that fascia.
Ah.
Can I give you
Oh,
something for you that people can use with dogs that's fun?
absolutely, yes.
Okay, you ready for this? I want you to
Yes.
take 2 hands and put it on the back of your neck and find the hardest trigger point.
Okay.
You got it?
Yep, I
Okay, so
do.
just 1 finger on that trigger point.
Uh-huh.
With your other hand and cup it and put it right behind your skull on your neck and attach it to right below your skull, and then I want you to pull down and we're gonna count for 20. Right? So pull
Okay.
straight down toward your toes. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11. Keep pulling. 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, you can
Okay.
let go with that hand and see, is the trigger point under your finger gone? It's
I
better.
might not have done it right. It's reduced. I might not have done it right though.
Yeah, so what you're doing is you're stretching that fascia
Mhm.
and
Uh-huh.
pulling it to allow the lymphatics and the jugular vein to empty the stuff from the brain that will often release a trigger point on the opposite side.
That's amazing. I love it so much. And yeah, this was when my cat went through this, it was about 10 years ago. So
Mhm.
it's been a while. He's had a very good life since then, for sure, but, um, he's my buddy boy. My buddy boy.
Aw. What's his
Yeah, so thank you, though. His name is Riley.
Aw.
Yes. My sweet baby. I actually bottle fed him. When I found him, he was so tiny.
How old was he?
He was, about 6 weeks. He may not have needed to be bottle fed, but I did it anyway.
Uh-huh.
Um, him and his litter mate. I actually just lost his litter mate about 2.5 months ago, but, anyway, yes, he came to say hi now that Kim got down. Well,
Right.
I wanna say thank you so much. This is empowering, I think, for
Thank you.
pet parents, um, because really, like, there's so much we can do, there's so many things we can do, and yes, your course is gonna cost something. I don't know how much your courses are, but to be able to do something that is so impactful and for free, basically,
Well, you learn it, and then not only do you have it for the pet you have now or the pets you have now, you have it forever, right?
right,
So you have that knowledge in your head that
mhm,
you can help all kinds of animals. And
yeah,
again, that's empowering people, optimizing pet health is right. So that ripple effect is what makes me just happy.
I love it so much. Thank you for being here and sharing this with us. Guys, please check out Dr. McCauley's courses. It's all linked in the show notes in the description. And yeah, and just so thankful for everything that you have done and that you are continuing to do.
Thank you. And thanks for
Thank you.
having me on. It's a joy speaking to you.
Aw, thank you so much. Guys, have a great rest of your week and please give your pets some extra love from me and from Dr. Laurie McCauley this week. And I will talk to you next week. Before you go, if today's episode got you thinking about what's really going on beneath the surface for your pet, don't forget to check out wildwellnesspet.com. You'll find the Wild Wellness Bioenergetic Test to help uncover hidden stressors, plus a curated apothecary of holistic remedies to support true root cause healing. Visit wildwellnesspet.com to start building a calmer, more vibrant pet from the inside out.